Hi, I'm Cassandra Mankwa, and in this presentation, we will begin by elaborating on care coordination in healthcare environment. Care coordination entails the purposeful organizing of patient care activities to ensure all patients' needs in terms of healthcare are synchronized to receive adequate care from multiple specialists and providers. Care coordination aims to help reduce healthcare costs by eliminating redundant procedures and tests, improving health outcomes, and ensuring care from different providers is not delivered in silos. Care coordination can occur in any healthcare setting, from primary care to long-term care settings. Therefore, nurses must aid coordinated care activities to improve patient outcomes and ensure the continuum of care. Strategies for collaborating with patients and families. Patients and families are instrumental in achieving desired health outcomes. Many strategies implemented in care settings for collaborating with families and patients aim to change the patient and family behavior to help realize anticipated health outcomes. Healthcare providers must identify and incorporate strategies to cooperate with patients and families to meet desired healthcare outcomes. Some proven strategies to integrate families and patients in care activities include personalized care, patient education, and self-management support. Patient education offers a foundation for greater involvement in care, while shared decision-making and self-management support provide greater chances for active engagement. These strategies effectively increase engagement and collaboration among patients, providers, and families, thus resulting in desired health outcomes. Personalized care planning is a strategy that incorporates shared decision making between providers, patients, and their families. Personalized care planning through shared decision making involves patients, providers, and families collaborating to identify needs and ways to meet improved health outcomes. Healthcare providers can implement this through shared decision making by creating a suitable environment for patients and their families when receiving care in the facilities. They can involve them in setting goals, identifying roles, and identifying accountability for desired goals. For instance, care providers will suggest regimens and other clinical components of care delivery. At the same time, patients and their families give their perspectives until they finally reach a consensus on their type of care delivery. Patient education and self-management support is an essential collaboration strategy where healthcare providers establish family or peer support groups. These groups help disseminate vital education on patients' health and needs. The support groups ensure that families and patients are appraised on health promotion and activities, effective treatments, benefits of adherence to agreed regimens, and resources they can exploit to achieve desired health outcomes. The groups also help with coping with emotions, managing and adhering to treatment, setting goals, communicating with clinical staff, and adapting healthy behaviors. For instance, patients will meet in support groups, interact with other patients, and discuss their perspectives, experience, and ideas on their treatment and improvement plans. This helps them engage in their health care, which translates to collaboration and improved outcome as they contribute to realizing enhanced outcomes. Case management. Changes is an inevitable process that everyone must experience. Changes are often hard to implement as human beings seek a stable environment. However, in the healthcare field, Constant changes, however, in the healthcare field, there is constant changes as healthcare practices continually evolve to meet the changing desires of the population. Technological advances, changing disease patterns, and policy and political reforms in the field. Therefore, change management is vital. Change management is vital that nurses and other care providers must master. Different features of change management directly impact elements of patient experience, thus impacting their perception of patient-centered care. To understand these aspects and their perception of patient-centered care, we must first distinguish between patient experience and satisfaction. Patient satisfaction deals with individual expectations on health encounters. Thus, it is realized when a patient's expectations during a healthcare encounter are met. Patients experience wide range of interaction with the healthcare system. Thus, it is rather patient's experience is assessed by identifying whether the various aspects of care delivery valued by patients, such as effective communication and timely appointments, were met at which frequency. Patients' experience reforms patient-centered care. Thus, providers must ensure they meet aspects of care delivery valued by their patients. There are various change management models in the healthcare system. These models have unique aspects that impact patient experience elements, vital to delivering patient-centered high-quality care. We will use the ADKAR model to identify these elements and their impact on care delivery. The model calls for awareness, desire, knowledge, ability, and reinforcements as the critical elements in initiating, implementing, and ensuring change continuity in healthcare facility. Awareness of the necessity for change and the desire to support change affects elements of experience by requiring care providers to communicate shortcomings and willing to support relevant changes in care delivery. This helps raise awareness on creating better patient outcomes, thus improving care coordination activities. Knowledge of how to change and demonstrate skills and behaviors affect patient experience and perception of high-quality, patient-centered care. For instance, providers who are knowledgeable on the need for change seek ways to gain relevant skills from refresher classes on novel care delivery systems. These providers can communicate effectively with patients and other care providers, thus ensuring they facilitate timely appointments that allow patients to receive responsive care suited to their needs. Moreover, reinforcement geared to make change in care delivery sticks also directly impact patients' sense of quality care delivery. The Strouds directly impact patient experience by allowing care providers to address any changes or hurdles in the novel care delivery approaches, thus empowering them to offer safe, patient-centered care. The rationale for coordinated care plans based on ethical decision making. Care providers contemplate numerous issues like patient needs, best practice solution, and ethical principles of care before arriving at a moral decision. During care coordination, patient-protected information is shared to enable seamless transition and continuum of care. Sharing this information allows for the development of coordinated care plans. Thus, it must be anchored on ethical principles of justice, non-maleficence, autonomy, and beneficence to preserve patient safety and confidentiality. Therefore, the rationale for coordinated care plan is to ensure ethical approaches to care are taken where patient confidentiality and safety are emphasized. In contrast, patients receive best care practices, achieving idealized health outcomes. Ethical decision making is guided by underlying assumptions based on the identified ethical principles. For instance, the beneficence principle assumes that sharing information during care coordination will benefit patients. Therefore, they must ensure patients' data and confidentiality are not violated during care coordination. Consequently, under autonomy, the assumption is that human beings have the right to make decisions about medical procedures. This impacts providers, care coordination, and ethical choices as they have to factor in the patient needs and consideration when delivering coordinated care. Therefore, moral principles are essential in the healthcare industry as they help guide practitioners in ethical decision making. Effects of specific healthcare policies on patient results. Healthcare laws serve as regulators of healthcare environment, which help realize desired patient results. The Affordable Care Act is a significant policy with provisions that impact patient outcomes and experiences. According to Courtman, the Affordability Care Act is designed to improve care coordination through developing novel care delivery models and payments. This act impacts patients' experience and outcomes by offering premiums through the Medicaid and Medicare programs to increase patient access to healthcare practices and services. Therefore, patients can access primary care and preventative services that improve their health outcomes. Additionally, affordable care allows patients to experience timely delivery of coordinated care activities like convenient appointments. Role of nurses in care coordinated plan. Nurses play a fundamental role in care coordination. They create partnership guided by the patient's and family's needs and preferences to ensure optimal allocation of resources to the patient's healthcare needs. They share knowledge on the patient with healthcare team members while working to aid the seamless transition of care. Nurses collaborate with relevant providers in the healthcare ecosystem to create proactive, personalized care plans to meet patient needs. Finally, nurses continue to support clients by connecting them with community resources that ensure they regain their health and functional capabilities once they transition from care. In conclusion, care coordination is a vital aspect of healthcare delivery. Care providers must incorporate the patient and their kin when creating care management plans, as they too form an essential part of care coordination. Nurses act as bridges by facilitating care coordinated efforts to ensure all elements of care coordination are met and patients realize improved outcomes. Healthcare policies impact care delivery. Thus, practitioners must strive to understand their provisions and ensure they exploit them to realize improved patient outcomes. Thank you.